I would just tell new social workers, don't limit yourself and be open to new ideas. Definitely be in the community, get out in the community just so you can hear what people are saying, so you can have an ear to the ground. So when you go back to your place of business and place of work, you at least can say, hey, I was out in the community and I heard 10 parents say X, Y, and Z. We might need to do something different.
Welcome in, you all. My name is Micah Horn, and today I'm here with Dr. Heather Savage, and we're going to hop right into another interview. First off, introduce yourself. Give us your name, a little bit of background, just briefly what you do. Yeah.
Yeah, thank you for having me. Again, I'm Dr. Heather Savage, and I am a social worker. I am a community leader, community organizer, strategist, child welfare worker, mental health advocate, all of the things. I've been in the field of social work for about almost 12 years now. My career started with the Department of Child Services. I was a supervisor, specifically working with youth who had juvenile delinquency focus and human trafficking focus, but really also worked on the assessment and permanency sides on the assessment side to really figure out what those better early intervention strategies for families to kind of divert them away from having delinquency involvement or any involvement with the system. And then I have a master's degree in social work, but also a doctorate degree in social work from the University of Louisville. But my master's degree is from IUPUI when it was IUPUI, so IU Indianapolis. But I particularly focused on, for my doctoral study, the most effective engagement strategies for Black youth ages 13 to 17. So we're looking at how do we bridge those gaps between like homeschool community, how do we address the barriers and the challenges between the three, better support families and kids, but then also how do we make sure the school knows what supports are available to them as well. So I've been doing this work for a while. I've got my own nonprofit. I've got my own business where I also help nonprofits start the organizations and really get everything established. I do a lot of trainings, leadership development workshops on board building, but then also how to just be leaders, how to be in this field, how to mentor new social workers that are coming in. So that's a little bit of my background.
You are all over the place. I love it so much. And I think your doctoral study of what you focused on is super interesting. I think we'll definitely touch on that later, but
Yeah, for sure.
that's super cool. Kind of bringing it to what you do now, your role at the Indiana Youth Institute.
Yeah.
You are the Central Region Outreach Manager. Yes.
Yeah.
I'm curious, what does that role look like? How has your kind of past experience impact how you lead this role now?
Yeah, for sure. I have been with IYI for almost 4 years. I transitioned from DCS here, like I said, the Central Region Outreach Manager. I have four counties, Marion, Johnson, Hendricks, and Morgan counties that are my focal points. And IYI is a statewide nonprofit. So we provide the entire state of youth workers with professional development, trainings, workshops, conferences, grants, consulting services, data services, things that help them to be the most effective youth workers, youth serving professionals that they possibly can. And so my role in my four counties is to make sure that people are connected to IYI, that people know the resources that we have that they can tap into to help them not just be better youth workers, but also to help better develop their organization, increase their organizational capacity. But we all, also want to make sure that they know, have the best skills and resources to be able to work with these kids. Everything that we do is for the children. But we also do that by supporting youth workers as well. So we bring them into our what we call youth worker cafes, which are like lunch and learns. And you have a particular topic on really anything, how to support parents and caregivers of, children that may have behavioral mental health issues, nonprofit sustainability, bullying and suicide prevention. Like we can talk about all of these things. And so really it's to enhance their toolkit. And so that's what I do there. So I'm out meeting with people, connecting with people. I'm always getting people asking me, hey, do you know of a mentoring organization? Or do you know of this? Or do you know of that? How can they get connected? How can they lean into the services and the opportunities that we have? My background really pushed me into this because I've always done work in the community. I've always been a leader. I've always served on boards and different things like that. And so I've always been a connector. And so this is just another way for me to expand that and reach more people. So when I started IYI, of course, I had my network of people that I immediately reached out to for speakers and just different things like that. But just to see how it's really expanded just the community, and making people more knowledgeable of the services that we have. But not only that, but just making them more knowledgeable as what services there is to offer in the central region. There are so many nonprofits, so many organizations. How can we help bridge even those gaps, so that everybody can start? I mean, and not necessarily saying everybody's going to work together, but how can we at least create pathways for people to know what's out there, work together and partner if they want to? And then also, if we don't, if there is something that my organization doesn't provide, I know 15 other ones that does. And so I just really serve as a link in the central region and try to connect people as much as possible to whatever resource or whatever community they need to be connected to.
That is super, super awesome. That was one of the things that I loved when I first moved to Indianapolis is just how many organizations there are that are wanting to help the youth, wanting to help underserved communities, wanting to connect, people just with professional development services, that kind of thing. I think that's super great. So I love that, and I love that your work in the past kind of showed up with that, with having speakers at the ready, having this at the ready. That's fantastic. I think it's it's hard because, like, even as we talk about it and we know we can rattle probably off 30 different organizations that do this work, it's difficult because it feels like a lot of people know about them at the end of the day. Like, I feel like it's still a never-ending battle of trying to get people aware, trying to get people to participate, trying to get people to do this and that. So it's it's definitely difficult work, and I'm happy that you're able to take that on. Super, super cool.
Yeah.
I'm kind of curious if when you were kind of transitioning into this role from your previous role, is this the type of role that you had in mind when you were transitioning, or you were like, I just kind of want to get out there again, see what's beyond? I believe you said CPS, right?
Mhm.
See what's beyond CPS, or were you like, oh, this is exactly where I want to go. I know I want to be here.
Yeah, I initially it was more of, and this is where let them talk came in, and the idea of I just want to have my own thing because we saw a need, we knew there was a need in our community. We serve primarily Black youth, and so we knew that there were some limitations. We knew that when we look at data, we don't see a lot of the our kids that we serve, a lot of families, our families that we serve in data or having access to certain resources, and so really I started thinking about let them talk very, very early on and trying to create something of where we can have something that was for us and that was by us. And then kind of just tapered off of the idea for a little bit because obviously I'm realistic. Like I have a family and I need to make money. And so I need an actual job right now. And then this opportunity presented itself, and I was like, "Oh, I love this! Like, I get to do professional development. I get to sit in the training, so I'm also, getting more for myself. I get to connect people. I get to be around my people. Like this is perfect. And so that's what like I didn't know when I left DCS. Honestly, I didn't have a job. I did not have a job. I didn't have a plan. I didn't know what I was going to do. This just really dropped in my lap. And from that, I just really knew that it was all God because everything just really lined up. Like everything lined up. Like there were no like, I left DCS, I wanna say on, like, the 11th, by the 31st, I was starting with IYI, and there was no issues with the process. It was very seamless, the interview process, everybody was so nice and so kind, and so I just believe that this was the next step, to what I had been doing, and even working at DCS, I was doing still, I was over, like, the morale committee, I was trying to outreach to the community, I was, partnering trying to partner with some other organizations to participate in their volunteer events. So I was doing some of this stuff. There's only so much you can do when you're, looking for the state under some of those umbrellas. So being able to switch over to IYI and kind of expand a little bit more was, I felt like it's been very beneficial for me.
Yeah, awesome. I love that. I think, yeah, when the cards line up like that, it's you know that that's something that you're meant to do, meant to step into. So
Yeah, for
I
sure.
love panned itself out like that for you. Yeah, that's awesome. Now I'm kind of curious because I feel like just when I was kind of like prepping for the episode, I feel like your experience kind of it covers a lot, honestly, and I feel like you've been in a lot of different you've had your foot in a lot of different doors. And so I'm kind of curious. This is kind of I have two questions that kind of stem from that. One, do you feel like social workers need to be that type of dynamic in order to stay, like, relevant, stay, like, on top of things just to excel? Or do you think there's still something to be had in just kind of, like, staying with your run role, kind of, doing that thing?
I will say I think that every position that I've had, every practicum or internship that I've had has made me be and helped me become the social worker that I am. I feel like, and I tell everybody, working at DCS, I feel like I can go work anywhere working at DCS. You learn so much how to, I mean, of course, work with people, but just how to work with different people, how to work with kids, how to work with the courts, how to write a court report, how to talk to officers, how to do investigations, how to talk to people at the hospital. Like you do so much. I mean, testifying in court, like it's you do a whole bunch of things all day. Every day is different. So DCS, I really feel like that prepared me to be super well rounded. Which is also why when I started, I was a permanency case manager. So dealing with families after they've already went to court, now it's a case, and we have them for until the case closes. But there was something about the assessment side that was very intriguing to me because I wanted to know what's happening before we get involved to where it becomes a case, even to where these families are not wanting to engage in services. And so during my MSW, I asked, could I switch to the assessment side because my practicum, I was with Families First, which is now they've combined with like Firefly and Children's Bureau. But I was with Families First and I was doing free counseling for students on Ivy Tech's campus. But seeing how one, people engage in voluntary services, and then seeing how people engage in involuntary services, that was very like, oh, okay, now I can see why some of these families pull away from services or don't wanna engage, like, okay, here's some barriers, and so I think, like, even just being in those 2 situations helped shaped my mind and just my perspective a little bit. And then, of course, like the community work and community organizing. How do we pull groups of people together to talk about this particular topic? How do we, in a sense, start a movement? How do we help grow this thing? How do we help do this? So, do I think that it's necessary for all social workers to have this well rounded experience and do a bunch of things? No, not necessarily, but it's worked for me. And I think my heart has always been leadership, it's always been community, it's always been bringing people together, and how can we all work together? I know everybody's not gonna work together and like each other, but in my mind, it's like, I just want us to all be a little family and we have this resource and you have that. So why can't we just all come together? I know realistically it's not gonna be like that, but how can we make it a little bit easier to like entice people to get on board with maybe that could work eventually down the road? But I mean, I do think that it is helpful to have different experiences. I do think that it is helpful to have mentors in the social work field that can show you different things. I mean, if you know you want to do hospital social work and that's all you want to do, that's great and that's fine. But there are still some things that you're going to need to know because you're going to be, really just stuck in that mind frame of hospital social work. I mean, but even for me, I came out of DCS and I was so DCS minded. Like I would just, everything was child welfare. I was second guessing everybody. I was just so like very leery and skeptical of people just off of the experience that I had. And so being able to move around and do something different, get other experiences, meet genuine people, kind people, honest people really help change, the different things that I had like really grown up in social work. So yes, having that experience is helpful, but also being in that lane, finding your niche, becoming an expert in that, and then training and mentoring other people could also be something that, could be good too.
Yeah, yeah. I love that approach. I think the best of both worlds is always the answer. Especially in a world like social work.
Yeah.
There's so many things to fight for and people to help and areas to be in. You have to like you said, it would be nice if everybody could just combine and come together and we could share everything. It's yeah. Now I'm kind of curious. This is kind of my second part to the question, and you honestly like alluded to some of the answers in your previous question, but I'm curious for somebody who is ready to kind of not even ready, but like thinking about stepping outside of maybe their kind of like home niche. Like how do you know when it's time to take that next step? How do you know it's time to switch gears? Like I think it can be very daunting for people to want to take that step because I mean even like you coming into IYI, maybe they didn't have a job lined up or something
Yeah.
like that for that after. So how can somebody navigate that?
It's scary. because, like I said, I didn't know, but I just knew that I needed something different, and I was getting, honestly, to the point of just being a little bit burned out. My son was getting older, and so participating in sports, I need to be a little bit more available to him. Plus, I was going back to school to get my doctorate, and so yes, it can be a little bit scary, nerve wracking, daunting, a little bit. But I think honestly, it was for me. I knew community work was what I wanted to do. And so when I did eventually start looking for a job, that's what I was looking for, something more community focused, something that aligned with like my skills. Like, yes, I know I'm this good child welfare supervisor, but I also know that I can deliver professional development workshops. I know that I can bring people together. I know that I can teach. I know that I can train. I know that I can plan events and I can do these things. And so I really started looking at things that align with some of my other skills. So I think that's what I would say to anybody that was looking to transition from one space in social work to the next. Look at some of your other skills that you have. How can you use those that are transferable to move into a different space? As like I said, for me, like even to like I have my own business, and so I also like I'm a consultant, so I do a lot of grant writing, but I also do wedding planning and event planning too. I know that's also my thing. I've done that for a long time. And so even with my role at IYI, having to plan 26 events a year, me being an event coordinator is perfect. It aligns right in what I do, another passion of mine. And so for me, it was just tapping into those other skills and then researching and finding something that made sense.
Yeah, I love that answer. I think that's perfect. I think, yeah, a lot of people forget that when they start their search again, or they start going to wanting to move on to something different. I think people are they forget a lot of the skills that they picked up while they've had the job that they're currently working, and they think that they need a whole new set of whatevers to achieve the next thing. So I think that's perfectly put. Yeah, absolutely. Now, yes, you've alluded to this a few times. I definitely want to talk about let them talk now. You kind of pointed to what led you to start it, but, just how is it going now? Like, where has it moved since you first started? And yeah.
Yeah, and so it was, of course, an idea, things that was thought about, and then kind of backburnered a little bit, but and then reignited when I had attended a conference and ran into. I've known Anthony for years, and we met Daniel at the conference, and it was another youth conference, but we just started talking about the things. We started talking about all of the things. Like it was a great conference, but we were still like something is missing. So we were like, let's start our own thing. Cool. So literally, like the second day of the conference, we sat and started building out, let them talk like in detail. Like I came back that next day with this is what's gonna look like, what y'all think about it. And probably after that conference, maybe 6 months later, we were filing the paperwork, rolling out everything. And so from where we are now, I mean, we had a team then, we still have a team now, but where we are now from when we launched, we started with 35 kids. And this past summer, we served over 278 kids in one event. So we've expanded. We have school based programs that we're expanding into in the spring. So that's wonderful. And just continue to make connections and partnerships with people, get our name out there, talking about who we are, what we're doing, inviting people to come and see because we can take pictures and videos all day long, but when you invite people into the space, they're actually able to see how do these kickbacks work? How do these let them talk clubs run? They can buy in. We took our kids up to Anderson at the end of August just to connect with another group up there to see how they were doing. And they literally was like, no, we want you to lead it. We want to see how y'all run it. We want to see how you get your kids to engage. And it was a really good turnout. It was a really good opportunity for us to, share our skills and our resources that we have. So Let Them Talk is doing very, very well. And we're looking for some new board members right now just because we've been in existence for 3 years. So we got some people that are rolling off. But we're looking for some new board members, a new board chair, just to try to Let Them Talk to the next level. But overall, Let Them Talk is, of course, it's doing very well. I think everybody struggles with funding and different things like that. But we've been able to sustain. At the end of the day, we're going to keep doing Let Them Talk because we know these kids need a safe place. They need to be around safe adults, but also the community of Black families, Black youth workers, educators, all of the things also need to be aware of the different things that are affecting our Black kids. And so, how can we make sure we're providing them with that education and resources too?
Absolutely. I love that. I'm glad to hear it's doing well. It's doing amazing things just in the past from what I've seen, and I think that's awesome. Again, organizations like this are like just super crucial in my eyes. I very much care about the youth, and it's getting harder and harder these days to engage with them, to tap into what they're into, and even just the amount of pitfalls that they can fall into even as they're growing up. So I think that's awesome. So you kind of talked about funding as that something that can be an issue for just like keeping let them talk going and all of its endeavors. And so I'm curious, like, what else do you kind of run into when you're advocating for these mental health, these professional development resources? What are other, barriers that, yeah, have come up?
Yeah, I mean, of course, funding, but I think also it's just engagement too. Engagement and lack of awareness and education. I think a lot of, not I think, I know just from doing focus groups, a lot of parents don't know what's available. They don't know what resources are out there. They don't know how to tap into some of these things. They have I think a lot of times there's a perceived mindset that things cost an astronomical amount of money, that it's hard to get in and different things like that. But in some places it's not. And so I think that is part of the issue, just like the awareness of it and educating and knowing, which is why we do our Melanin Table Talk series, the state of the Black community, and really talk about these things so that parents can know and be educated. Like, no, this is what it exactly is. And it's not coming from let them talk. We have a panel of lawyers, of educators, of pastors, community leaders, of CPAs, of doctors, of licensed social workers, people that can come and really give this content information for parents to better understand it. I know when I was doing my focus groups for my doctoral program, a lot of it was engagement and not being able to know where to go, who to contact, their own personal struggles of having multiple kids and no transportation, or I have to go to work, because I have 4 kids, just different things like that. So that's where the engagement piece comes in. But I also think at times, schools and entities can also be barriers too, because I think when parents come in and they're asking schools, for these services or asking schools for these things, you have some social workers that don't know what's what's out there. But I think, but then there's also these firewalls that schools have up too, and so they only do so much and only give so much information. Or if you don't show up to a parent teacher conference, now you got the school holding that over your head when you just had to be at work. And so I think so. Not I want to keep saying. I think I know all of those things are barriers because I heard parents say, the like I can't even get to do. I can't even get the school to do X, Y, and Z because I missed a parent teacher conference earlier this year. So they still mad at me because I didn't show up or different things like that. And it's just like we have to figure out ways to eliminate those things and how do we better work with these families? How do we work with these parents that are at least trying? They might not be perfect, but they are at least trying. And so how can we come, alongside them and work with them and give them a little bit of grace? But those are some of the things that I have seen. Um, like I said, engagement, lack of awareness and education. And then, like I said, funding piece too. Um, yeah.
Yeah. Yeah, that's really tough to hear that school portion about, them kind of holding that over people's head because like you said, there's so many factors as to why they didn't show up to that parent-teacher conference or why they missed XYZ, and it's baffling to me that they would. Yeah, that's crazy. And honestly, it's so much mentally, like, I can't even imagine what it does mentally to be a social worker and to have to endure these kinds of situations. Like, even to your point earlier about switching from DPS because your son was getting older and that kind of thing. My mom used to work in social work and kind of the same thing when she first got pregnant with me, she was like, I'm done. I can't be in that world. It's just a lot to have to deal with. So I'm kind of curious, and I know the answer is different for everybody, but how do you stay active and on top of these things without burning out? It seems so hard to separate that because I know me, I'd be thinking about XYZ case all night or this, visit or that kind of thing. It's tough.
Yeah. When I was at DCS, I had a really hard time detaching, but that was, I mean, DCS is tough. Plus, when you're on call, at least 4 or 5 times a month. So it was very tough to to detach. But I think I noticed, like, when I started kind of just, like, getting irritable, irritated, wasn't staying on top of not like things that were detrimental, but just like my if I had a staffing note or something like that, I'm like, I'll fill it out, after this. But no, normally, like I'm on top of it. I'm preparing weeks ahead of time. I'm, just doing. I noticed that when I would kind of like fall back on like my organizational things, then I'm like, I might need a little break. I mean, when I left DCS, I had so many hours of vacation time because I never was sick of vacation. But once I started taking vacation, then it was like, okay, I'm getting ready to leave. So I didn't have that much time. But you do get burned out. You do have to recharge. I think um it was like I said, even just being on call, weekends, holidays, a couple times throughout the week, like it just becomes a lot. I think not I think I had to just make the decision of what was going to be best for me. There was never a time when I was working at DCS that I feel like I couldn't take my work home, even though I walked out the office. Even if my people wasn't on call with me, they was on call with somebody else. And so they were still calling me because they were like, bosses don't sound right. And so there were no real periods of detachment there, which made it difficult to not be burned out. But kids' lives are at stake. So you really just got to keep on pushing. But even now, like with IYI, like I we work from home, but I take a lunch break. I'm off at a certain time. I'm not dealing with kids' lives necessarily. So, whatever don't get done today, it'll get done tomorrow. And I'm okay with that. And I go to sleep at night and just worry about, that tomorrow. But I'm, pretty hard worker. Like I get all my stuff done. There's really no issue, nothing being left behind. But I'm intentional about making sure my weeks are set up the week prior, making sure everything is done, taking care of organization. So I'm not being burned out by the end of the week. Now, by the end of the year, like now, I'm tapped out and I'm ready to take a break. So good thing IYM gives us some time at the end of the year um, to take off. And then I added in some extra time. So I'll be off for the next 2 weeks at the end of the year. And I literally shut down everything. So it's not just work, it is let them talk, it's my business, it's everything completely closed because it gives me time to just reset, get everything together for the new year and just really recharge, just think about everything that I've done this year, everything I've accomplished, and then what, goals are for next year. So that's how I've been able to balance that part out. And then I've been trying to take more, just not necessarily vacations, but just like a day or just, here and there just to make sure that I'm like not getting to the point of like, okay, I'm super overwhelmed.
Yeah, yeah, definitely. Awesome. I love to hear it. Yeah, it's hard to balance, but like yeah, you end up having to find stuff that works for your own schedule and not being afraid to take those vacation days, take those days off, take those time take that time for yourself. You said what?
I said, take those days.
Exactly, exactly. Awesome. Well, that's technically all the questions I had. Is there anything that I did not bring up or talk about that maybe you want to speak on or
No, not necessarily don't have anything. I think I would just encourage, social workers coming into the field to it's okay. You're not gonna know everything and, be willing to learn, but also like we need new ideas, we need creativity, we need innovation. So don't be afraid to speak up if there's something or a process or procedure that doesn't feel right to you be okay and comfortable with adding that into your conversations with your bosses and your directors, different things like that. I think those we always look for fresh minds in the field, and how can we do things differently to engage our clients better? How can we make them feel more safe and more comfortable? And so I think, I would tell them that, link up with a mentor, somebody that can work with you to have these tough conversations so you can figure out who you can bounce these ideas off of. But also, if you're having a situation or a scenario at work and you need some extra guidance, could be a situation somebody else has gone through. So don't be afraid to have a mentor somebody that can help guide you. And don't be afraid to change to something different. If you get into DCS and you feel like it's not right for you and you want to go into school social work, that's completely fine too. But even if you don't want to do that and you want to be a probation officer or you want to do something with the courts, like there's so many different things within social work that you can do. So I would just tell new social workers don't limit yourself and be open to new ideas. Definitely be in the community, get out in the community just so you can hear what people are saying and so you can have an ear to the ground. So when you go back to your place place of business and place of work, you at least can say, "Hey, I was out in the community and I heard 10 parents say X, Y, and Z. We might need to do something different." So I think being in the community is helpful. It helps you stay engaged and connected. And so I would just encourage people to do that. And then, like I said, just don't be afraid to connect with other social workers and lean on other social workers. And I'm always here available as a resource to connect and bounce ideas off of or talk through or have coffee or whatever. So we don't want social workers melting down and not want to continue to do this work. So I'm here as a support and I have a supportive group of other social workers. There are people out here that are willing to come alongside new social workers to be a support system.
I love that. That was a beautiful way to put it, and it's that's I mean, it's social workers, are just such a nice community. Everybody is so, very willing to talk to each other, speak to each other,
Yes.
communicate, share ideas, like you said. Like, I love to see that because I know other fields are, can be a little more cutthroat, and it's not as, like, everybody's friends with everybody, so that's one thing I do love about social work.
Yeah.
Well, thank you so much for talking with me today, Dr.
Sure.
Hodge. It was amazing. It was amazing. Yeah, your experience is amazing. I loved hearing about Let Them Talk and all that. So thank you so much for being a part of everything today.
You're welcome.